Hey guys, Dr. Nathan Thompson here with Exemplify Health Center. And if you're watching this video, it means that you have received some food allergy testing. So I want to walk you guys through the why and how food allergies develop so that you can start actually following your food allergies and start avoiding those inflammatory triggers. But if you guys can get a little bit better understanding of it, it will help you as far as on your journey towards getting better and removing some of those initial inflammatory triggers that start to develop. So one of the reasons why we send you the food allergy testing as quickly as we get it is so not only you can start avoiding those inflammatory triggers, but number two, so that maybe you can overcome the shock of seeing foods that you might like that can become very inflammatory in your body and can be one of the reasons why you're having issues with inflammation or issues with hormones or issues with infections and things like that. So let's talk a little bit about this. Number one is that when you look at food allergy testing really is an immune system test. Now, I will tell you this is that when it comes to digestion, your immune system should never be involved. So when you do have food allergies, it means that the immune system is involved. It means that the body has actually seen those proteins that are coming from those foods, and it is treating it as if it was a foreign invader, which is why you're having an inflammatory response to it. The other reason why it's a good immune system test is because with some people who have a lot of food allergies, it can actually signify that there's a lot of proteins that are actually leaking through. But in the other aspect, if people are immunosuppressed, meaning they may have been on some corticosteroid medications, things that actually try to knock out the immune system, such as the case of autoimmunity, or in other cases where people have had cancer, they've undergone cancer treatment in which they've been given chemotherapy that kills the immune system. For those people, they're going to see very low reactivity to those foods, and it actually will tell us that we really need to rebuild the immune system. So it's really an immune system test, and you'll see on your sheet that there's two types of tests that we looked at. There's an IgE reaction, and then there's an IgG reaction, and those are different types of immune system reactions. The IgE reaction is one that you would think of kids who have a peanut allergy or have an egg allergy, and they're walking around carrying an EpiPen in case they have some kind of exposure to it. That's a different type of immune system reaction, and it's called anaphylaxis. We don't see that as often, but when we do, it means you have to avoid eating those foods. But the type of reaction that is a lot more common is the one that is happening around the gastrointestinal barrier, and that's known as an IgG reaction. These are the things that are actually associated with things like having irritable bowel syndrome, having bloating, having joint pain, having brain fog, because that inflammation can then become systemic once that gastrointestinal barrier becomes inflamed. So number two, what it's also measuring is it's measuring the strength of the antibody response. So you may notice when you look at those foods, what is the +1, what is the +2, what is the +3, +4? What does that mean? And that really has to be, really is about the strength of the antibody response. So a lot of people say, well, it's just a +1. Do I have to avoid it? The answer is yes, 100%. You have to avoid it. In fact, these are some of the most dangerous food allergies because it will take a long time in order to develop or to get an antibody response after you eat it, which means it can take 3, 4, 5, 6, even 7 days for you to notice that there's a reaction taking place. So whether it's a +1 or whether it's a +4, in which you have a very strong and a quicker type reaction, avoiding all of them is always going to be the way to go. Now, another question you may have when you're looking at your food allergy test is, why are there so many foods that I enjoy on this list? And I'm going to explain it to you right now if you look at this picture right over here, because what it means is it means that the foods that you are eating, there's two things that are happening. You're not breaking down your food well enough, which primarily occurs in the stomach and with the pancreas releasing enzymes and with the gallbladder releasing bile to break down your fat. So you need all three of those organs to start to break down your food the way that it's supposed to, depending on if it's a carbohydrate, a protein, or if it's a fat. So number one, what has to happen is the foods are not being broken down the way that they are supposed to. And then number two, it means that that protein that hasn't been broken down has to have a way to leak through the barrier of the gastrointestinal system. As barriers are really important. You have a barrier that's in your gastrointestinal system. You have a barrier around the lungs. You have a barrier in your skin. You have a barrier in your genitourinary tract. And all of that is to keep proteins, foods, bacteria, viruses out from invading and getting into the internal environment of the body. So remember, the body, the immune system wants to fight the battle at the barriers and not once the barriers have been breached and you have to fight a battle within the body. So the reason why you can have a lot of the foods that you're eating is because, number one, you're not breaking them down. So what can cause the foods not to get broken down? Number one. And number two, what can cause this barrier to start to become compromised? Well, number one, stress is going to do it. We live in a society where everyone is stressed. When you're in fight or flight, that will lower the release of stomach acid, which means you can't sterilize your food and you're not going to be breaking down your proteins very well. Number two, the exposure of toxins will cause the gastrointestinal barrier to start to break down. The most common one is actually going to be glyphosate, also known as Roundup. And Roundup is basically a weed killer, but it is used in corn, it is used in soybeans, and it is used in wheat. And it's also within our water system as well. That will destroy the gastrointestinal barrier over time. Number three is going to be food particles, specifically foods that you are not breaking down, but also one of the most common ones is going to be wheat gluten. If you look at wheat gluten actually will signal the gastrointestinal barrier to open up, which means a lot of the foods that you eat with wheat gluten can also then become a food allergy as well. Drugs will do it, things like antibiotics, aspirin, certain prescription medications can compromise the gastrointestinal barrier. Pathogens, a common one would be E. coli, for example, or you have an organ malfunction like the stomach's not working the way it's supposed to, the pancreas is not working the way that's supposed to, or the liver and the gallbladder aren't breaking down the foods. So you may have one, you may have two, you may have all of them, and then over time, the gastrointestinal barrier starts to become compromised, which means the foods that you are eating begin leaking through the gastrointestinal barrier, which then will develop a food allergies, will then cause inflammation, known as immune system issues. And this is a big, big reason why a lot of things can then further develop into what is known as autoimmunity. This is the reason why a lot of the foods that are on your food allergy list might be the ones that you are eating. Number four, when you look at the number of foods, okay, so why do I have 8? Why do I have 35? Why do I have 22? A lot of it is going to be dependent on how diverse of types of food that you are eating. Some people only eat a few foods every single day, in which they may only have 7 or 8 food allergies. And some people may be eating 35 or 40 different foods and have a very leaky intestinal barrier, which is why different people have different numbers of food allergies when they look at their list. So you look at how much food you're eating, how diverse you're actually eating, how leaky is the gastrointestinal barrier, and then what's happening with your immune system as far as being able to have an antibody response, okay? So hopefully, guys, that gives you a little bit better understanding of food allergies. We'll be able to explain a little bit more in detail at your first consultation. But the biggest thing as far as your first steps are concerned is, even if you don't have a total understanding, please, please, please start avoiding all of those foods that are on your food allergy list, whether they're an IgE reaction or an IgG reaction. Anything in the red means please avoid. The good news is when you look at the blue means that you are free to have that at least until we go over your food allergy list and your additional labs, because we will be likely to give you further direction as far as foods to be avoiding as well when it comes to handling maybe an insulin response, blood sugars, and things like that, which is also very, very important. So guys, your first steps, start avoiding the foods that are in red, whether they're an IgG or an IgE, and just make sure that you start avoiding them, start taking your initial supplements until your first consult. And then what we'll be doing at that time is going over your labs completely, going over with you a plan as far as what we should be doing actually starting to finish up some supplements if you are on them, or we may be adding some additional ones based off of your lab testing. So hopefully, guys, this gives you a great understanding starting out of the why the food allergies, why we do them so often and how they develop. And your job is to get to work. So guys, be well, and we will talk with you very soon.